there's a new virus out there. And if you're like me and you have trauma from COVID times, I had to find out for myself about this monkeypox virus that people are talking about in the news. Apparently, the people at highest risk of exposure to Mpox being the way monkeypox is described in contemporary terms, are men who have sex with men. I still don't know why they wouldn't just call that gay, but men who have sex with men and individuals who have sex with men who have sex with men. Anyways, and they say people who meet at least one of the following criteria are also at high risk. People who have two or more sexual partners who are in a relationship where at least one of the partners has one other sexual partner. You could just say you're a slut. That works too. Just, you're shagging around. That works too. That works too, The other people who are at high risk are people who have had a confirmed sexually transmitted infection in the past year. Um, Also, individuals who identify as sex workers and staff or volunteers in sex on premises venues where workers may have contact with objects or materials that may be contaminated with the Mpox virus. Okay, so those are the people at highest risk, according to the Public Health Agency of Canada, of contacting Mpox, monkeypox. That was a fast start, but let's backtrack a little bit. The World Health Organization has recently declared monkeypox, now known as Mpox, a public health emergency because of a new outbreak in several African nations, with at least 3 cases now reported outside the continent of Africa. Here's a little bit of history for you, okay? Here's a little bit of history. Since it was first identified in a colony of monkeys in Copenhagen, Denmark, in 1958, monkeypox has been largely overlooked by the Western world. An infectious pox virus that causes fever, chills, and rashes. The disease is endemic or consistently regionally present in 10 African countries. According to the World Health Organization, after 1970, Mpox occurred sporadically in Central and East Africa, and these were clade 1 transmissions, and West Africa, where clade 2 transmissions were reported. And in 2003, an outbreak in the United States of America was linked to imported wild animals, and this was a clade 2 transmission. Since 2005, thousands of suspected cases are reported in the Democratic Republic of Congo every year. And in 2017, Mpox reemerged in Nigeria and continues to spread between people across the country and in travelers to other destinations. In May 2022, an outbreak of Mpox appeared suddenly and rapidly spread across Europe, the Americas, and then all 6 WHO regions, with 110 countries reporting about 87,000 cases and 112 deaths. The global outbreak has affected primarily, but not only, gay, bisexual, and other men who have sex with men, and has spread from person to person through sexual networks. Okay, so that's a little bit of a short history, but clearly here, the first discovery of monkeypox was actually not in Africa. Who knew? Anyways, monkeypox is a viral illness caused by the monkeypox virus, a species of the genus Orthopox virus. And the common symptoms are skin rash, mucosal lesions, which can last 2 to 4 weeks, accompanied by a fever, headaches, muscle aches, back pain, low energy, swollen lymph nodes. Obviously, there are other infections that can cause these exact same symptoms. Hence, sometimes it can be misdiagnosed if people are just observing symptoms. Things like herpes or syphilis or chickenpox or measles or bacterial skin infections can look really similar. And so for these reasons, testing is important in order to confirm Mpox. So detection of the Mpox viral DNA is done using like a PCR. So similar to your COVID, they're done using a polymerase chain reaction test. And the best diagnostic specimens are taken directly from the rash, so from the skin, fluids, or crust collected from vigorous swabbing of suspected infected area. And if you don't have lesions, in the absence of skin lesions, because that happens, not everybody with Mpox develops like widespread lesions. So in the absence of skin lesions, testing can be done or on the using a nasal swab or a swab of the throat as well. Obviously, monkeypox is no joke. But luckily for us, we've got another virus which is remarkably similar. Actually, they belong to the same family, the smallpox virus, the now eliminated smallpox virus, which is remarkably similar to the monkeypox virus. There are vaccines that have been used in the past effectively for smallpox, which are very effective for preventing monkeypox. And in the United States, the Center for Disease Control recommends the Jynneos vaccine, which was licensed in 2019 to prevent smallpox and Mpox. It's made by the pharma company Bavarian Nordic. And the second one is the ACAM 2000. It's a second generation vaccine that contains a live vaccinia virus that replicates efficiently in humans. It is manufactured by the Emergent Biosolutions. In Canada, the Imvamune vaccine is authorized and is indicated for immunization against like smallpox, Mpox, and other orthopox infections for adults 18 years and older, and people who are at a higher risk of exposure. If you do have Mpox, the Public Health Agency of Canada suggests you should avoid leaving your home unless you need urgent medical care. You should avoid contact with people, avoid directly touching people or contact with your animals, because just so you know, it's possible to transmit the like it has been shown that pets can also get sick from Mpox and can also transmit Mpox, right? So you should avoid contact with your pets or livestock and with wildlife. And you should they suggest wearing a well-fitting medical mask, clean your hands and cover your coughs and sneezes. Essentially all the things we did during COVID. I know this brings back memories. Obviously you don't want to donate blood or sperm or tissue in this time period if you have Mpox. So if you have been exposed, usually the symptoms do resolve themselves. So calm down, calm down. Even if you're not vaccinated, it takes about 21 days to resolve themselves. If you're an otherwise healthy person, they should resolve within 21 days. So the Public Health Agency of Canada recommends that you self-monitor for symptoms of Mpox. You avoid taking medications that are known to lower fever, as those may mask your symptoms, ibuprofen or acetaminophen, for example. And when you cough, just endeavor to kind of cover your coughs and sneezes and clean your hands. And what you want to do is stay home in your own room if possible. Wash your hands regularly. You remember the drill from COVID. Yeah, do a lot of that. Wear a mask. Keep your skin dry. Avoid touching items in shared spaces. Take warm baths with baking soda or Epsom salt for body sores. And apparently you can take over-the-counter medications for pain like paracetamol or ibuprofen. Do not pop the blisters or scratch the sores because it can slow your healing and spread the rash to other parts of your body. Okay? And do not shave areas with sores until scabs have healed. And do not shave areas with sores until scabs have healed and you have new skin underneath. So that's my spiel on monkeypox. At the beginning of this conversation, I was kind of concerned. I thought we were about to launch into another COVID situation. Turns out, well, monkeypox doesn't quite move quite as fast as COVID did. And hence, because of the maybe significantly diminished transmissions, it's not as deadly. But also, on the other hand, you also got to think about the fact that we're also a bit more prepared for like a monkeypox kind of situation in terms of vaccines, because we've had that similar infection with like smallpox. They now eradicated smallpox. We have effective vaccines that work for smallpox that are now easily applied to monkeypox. And it does sound like, one of the biggest ways that the virus is transmitted is through sexual contact. So if you have ever wanted a sign not to be a slut, this is the one. Stop it. Okay? See you on the next one.